Losing your hair often feels like losing a piece of your identity. Watching your hairline recede or finding clumps in the shower triggers severe psychological distress and a measurable loss of self-confidence. This animated diagram breaks down the biological engine keeping hair on your head, a continuous loop of 4 strictly regulated phases. You have the active growth phase, known as anagen, the transitional catagen phase, a resting telogen phase, and the final shedding phase, called exogen. But that engine is highly vulnerable to its external environment. If you wash your hair in hard water, common across the Indian subcontinent, you expose those strands to heavy concentrations of dissolved calcium and magnesium. Over time, these minerals form a rigid, calcified crust around the hair shaft. That dense mineral shell completely blocks out external moisture. The strand dries out from the inside, leading to extreme brittleness, severe friction, and inevitable mechanical breakage at the root when you try to comb it out. You can neutralize this specific alkaline threat with basic chemistry. Rinsing your scalp with apple cider vinegar uses acetic acid to dissolve the mineral buildup and restore a healthy pH. Applying a hydrophobic barrier, like coconut oil, half an hour before showering physically blocks those heavy minerals from entering the cuticle in the first place. Protecting the hair shaft from the outside is relatively simple, but when the follicles themselves stop producing hair, the failure is occurring deep within your body. Fixing that systemic failure forces us to choose between 2 very different medical philosophies. Traditional Indian medicine, or Ayurveda, categorizes general hair loss as kalidia. Rather than treating a bald spot as an isolated skin issue, Ayurvedic physicians view it as a symptom of a systemic, total body disequilibrium. This diagram illustrates that exact pathogenic concept. In Ayurveda, consuming excessive spicy foods, alcohol, or carrying unresolved emotional stress elevates pitta, your body's metabolic heat. This excess heat travels through the blood and literally scorches the scalp's delicate tissue, destroying the cool environment necessary for follicular survival. The damage compounds when your sleep is disrupted. Poor rest depletes ojas, your vital essence, and halts the overnight regeneration of bone tissue. Because Ayurveda considers hair a direct byproduct of the skeletal system, failing to rebuild bone tissue directly starves the follicles up top. While the language sounds ancient, modern molecular biology supports the efficacy of its active ingredients. Extracts from Bhringraj, known as the ruler of hair, have been shown in laboratory models to actively suppress a protein called TGF-beta1. By shutting down that specific protein, the plant forces resting follicles straight back into their active growth phase. The traditional method of applying these botanicals involves a ritual called sneha, massaging warm infused oils into the scalp. Using a specific copper tin alloy tool called a Kansa brush mechanically dislodges calcified sebum, increases local blood flow, and lowers your sympathetic nervous system tone to actively reduce the stress that caused the heat in the first place. By pooling the body and manually stimulating the scalp, you address the biological root without synthetic chemicals. The obstacle here is regulatory. Western health agencies refuse to authorize these treatments because they lack the large-scale, double-blind human trials required by modern clinical medicine. The modern Western medical approach abandons holistic body balance in favor of precise, highly regulated chemical warfare. This diagram outlines how that synthetic targeting works for male pattern baldness. A daily pill like finasteride acts as a selective inhibitor. It aggressively hunts down the specific enzyme responsible for converting testosterone into DHT, the hormone that shrinks hair follicles, and physically blocks the reaction. While that drug stops further miniaturization, you can apply topical minoxidil at the exact same time. This compound forces cellular potassium channels open, causing nearby blood vessels to expand. This floods the starving follicles with oxygen and nutrients, pushing them back into the anagen phase. For autoimmune hair loss like alopecia areata, where your own immune system attacks the hair bulb, the latest Western intervention goes even further. Newly approved JAK inhibitors target and shut down the specific inflammatory signals driving the autoreactive T-cell attack, yielding massive regrowth in patients who had lost all their hair. These clinical results are undeniable, but they exact a heavy physiological toll. These drugs require lifelong dependency. If you stop taking them, the hair falls out again. More importantly, by broadly suppressing your immune pathways, these medications carry standard FDA black box warnings for severe opportunistic infections and major adverse cardiovascular events. You receive clinically proven aesthetic regrowth, but you pay for it with continuous blood monitoring and a persistent, calculated risk of severe synthetic side effects. Fortunately, the choice between ancient holistic herbs and risky synthetic drugs is disappearing. Modern trichology is transitioning toward advanced regenerative medicine. Researchers are now utilizing exosome therapy. Exosomes are tiny extracellular vesicles that act as intercellular messengers. Instead of relying on a patient's own blood quality, doctors inject highly standardized, lab-derived exosomes straight into the scalp, delivering complex therapeutic cargoes of growth factors directly into dormant cells. Scientists are even extracting these messenger particles from botanicals like brown seaweed. These plant-derived exosomes penetrate the scalp and instruct human cells to repair themselves, offering clinical-grade growth without any of the ethical or immunological risks of using human donor tissue. There are also highly advanced bioengineered solutions like QR678, a mesotherapy treatment developed in India. It utilizes synthesized plant peptides that perfectly mimic the endogenous growth factors of a young, healthy scalp. Injected just beneath the skin, it multiplies hair density while entirely bypassing the harsh side effects of oral medications. If the follicles are already completely destroyed, surgical transportation remains the definitive fail-safe, but even that has evolved. Today, AI-driven robotic platforms optically map the donor area on the back of your head, calculate the exact spatial distribution, and extract DHT-resistant follicles with a mathematical precision no human surgeon could sustain over 10 hours. Keeping your hair is a multi-front campaign. It requires chelating the harsh minerals in your water, managing your systemic physiological stress, and leveraging the exact biological signals your body needs to rebuild itself. That is how you win the war for your scalp.